Hello everyone. Today we'll be starting for the drugs for urinary tract infection. You know very well urinary tract infection is a very severe disease because it is caused by E. coli, and generally maximum the women are suffered by this disease, and the causative organism E. coli and different bacteria also can cause the disease. Especially this infection occurs in the urinary tract, and which includes the kidney, bladder, ureters, and urethra also. So now type of the urinary tract infection, that is based on location, they are classified into three categories: cystitis, that is lower UTI; pyelonephritis, that is upper UTI; and urethritis, that is urethra. The causative organism is the E. coli and sometimes some bacteria. So in case of lower UTI, that is the where it happens in the bladder, symptoms from lower urinary tract infection like pain with urination, frequent urination, feeling the need to urinate despite having an empty bladder also. You might also have lower belly pain and cloudy or bloody urine. Okay, and pyelonephritis or upper UTI means that is affected in the kidneys. This can cause fever, chills, nausea, vomiting, and pain in your upper back or side also. Now coming to the urethritis, that is coming to the urethra. This can cause a discharge and burning when you pee or urinate. And now going to the different treatments. So drug used in UTI. So there are three categories of the drug: urinary antiseptic, urinary analgesic, and antimicrobial agents. So antiseptic means they are the disinfectors as well as they are also causing the different antimicrobial, anti-infective agents act as. So some orally administered antimicrobial agents attain antibacterial concentration only in the urine, like nitrofurantoin and methanamine. So nitrofurantoin is the most important drug for the UTI. Now, urinary analgesic that reduce pain are phenazopyridine. Now, coming to the antimicrobial, and there's quinolone, norfloxacin, ciprofloxacin, cephalosporin, cephalexin, ciprodoxin, otrimoxazole, amoxicillin treatment also, ofloxacin, like this. Now, coming to the antimicrobials that is used and their doses. Okay. Now, norfloxacin that is used 400 mg 12 hourly or 8 hourly. Ciprofloxacin, ofloxacin, cotrimoxazole that is coming under ointment. Now, cephalexin and cefuroxime proxetil. Next, amoxicillin is nitrofurantoin. These are the important drugs for urinary tract infection agents. Now coming to the quinolone, that is the important structure where basic quinolone ring is shows by the one benzyl group on one with nitrogen containing future saturated ring, where R and R1 or R2 at the 1-3 position plays an important role for different debridization, and oxo group is also playing very important role for the killing of bacteria. These are synthetic antibacterials having quinolone structure that are primarily used against the gram-negative bacteria, and though the newer fluid compound also inhibit gram-negative or gram-positive bacteria also. Actually, this E. coli is a gram-positive bacteria, and some fluorinated compound can inhibit the this urinary tract infecting microbes also. Now coming to the first generation quinolone, the first generation compound naltrexonic acid is introduced in 1960, and usefulness limited to urinary tract and GI tract infection because of low potency, modest blood and tissue levels, and restricted spectrum and high frequency of bacterial resistance. And they have limited antibacterial spectrum. Naltrexonic acid, miloxicam, and oxalic acid, and flumequine, and piperamidinic acid and roxazine. This is the naltrexonic acid where quinoline to quinolone ring is been attached. Okay. Two nitrogen containing heterocyclic member, that is two pyridine molecule, will be there. Now second generation quinolone, that is a fluoroquinolone. Here you can see two benzene ring is there, they are attached, and one is piperazine ring molecule present with this compound. Two nitrogen containing 6-member ring. Okay, so this is a very important structure and easy also. A breakthrough was achieved in early 1980s by fluorination of the quinolone structure of admission new introduction of piperazine substitute and saline substitute, resulting in bacteria called the fluoroquinolone with the high potency. And uh, what do we say? Is there any difference? They have extended antivirus like ciprofloxacin, ofloxacin, pifloxacin, ofloxacin. So coming to the name of the drug, you will see here. Just one second. So here ciprofloxacin names 1 cyclopropyl, 6 fluoro, 6 fluoro, 4 oxo, 7 piperazine. This is same position of piperazine. 1,4-dihydroguanidine. 1,4-dihydroguanidine. These are the important name of the guanidine. Okay. And this is the structure of the fluoroquinolone. Now coming to the next structure. The mechanism of action I can see, these drugs are generally breaking the bacterial DNA guidase enzyme. They quinoline block the different synthesis of DNA replication by DNA guidase enzyme and topoisomerase 4 that are type 2 topoisomerase. Okay, so these enzymes are broken down by the DNA guidase or the quinolone drug. Inhibition of topoisomerase 2 prevents the reduction of positively coiled DNA and inhibition of the topoisomerase 4 and with this is important. Okay, and antibacterial spectrum. First are effective against certain pain gram positive. Okay, some there are bacteria which can cause pain also whenever they are infecting. Okay, or E. coli, Shigella, these are the drugs. Now, the generally uses UTI, gonorrhea, bacterial cystitis, RTI, soft tissue infection. There we can use the unilateral infective agents. Now, if we go for the structure of the what component, this is the fluoroquinolone. Here the basic thing, the 6 membered, 2 membered, and 1, 2, 3, 4, 5. Around R1, R2, R and the basic ring appears 6 important facilities of closure after the modification to improve the activity of the drug R1, R5, R6, R7, R8. And X defined as the quinolone, X equals to C, and X equals to N defines the naphthohydradrones. Okay, these are the important example. You can say. Now, uh, now there are different SAR of this drug that you have to study very vivid or very descriptive way. And next, lactic acid is one of the important drug where two R1 group, R1 and R2 group is substitute CH1 and CH3. So that inhibit DNA guidase enzyme and that's used mainly in case of infection and used a tool in studying the regulation of bacterial division. Now there are another drug enoxin which is not included. Now ciprofloxacin, that is one of the important drug that is also having the quinolone structure. See, remembered quinolone structure. Okay. Next, there are different triangular ring that is okay. Will not be studied. There are some synthesis procedure which you have to study on your own. Okay. Next, we are coming to the norfloxacin. And they are used mainly in the topoisomerase 2 and topoisomerase 4. Lower upper tract infection, they can create effects. And the structure is also same, the ciprofloxacin, but there is a fluoro introduction. Now, ofloxacin, there is also same, sometimes there is one health group and one like stage 3. They are introduced the topoisomerase 2, right? Okay. Ofloxacin, important drug. Lifehousing sometimes. Okay, that's one trend. And then methanamine, this is a hexanamine drug. That is hexamethylmetramine, which is bioactive, such as sorry, next the methanamine, that is hexamethylamine tetramine, which is inactive, such as decomposes slowly and used in prophylaxis of UTI. That is not so much used. So up to this we are concluding, and you have to study in your notes or books. That's why you will be getting more knowledge.